Hello and good afternoon, and thank you for joining us. My name is Chris Erian from the AMA Queensland Council of Doctors in Training, or CDT, representing the Wellbeing portfolio. It's my utmost pleasure today to facilitate today's In Conversation webinar with Dr Ira Steenstraten, our Wellbeing at Work Facilitator and Doyen. Before we begin, I'd like to acknowledge the traditional custodians of the land that we all live and work upon, and pay my respects to elders past, present and emerging. Today we're talking about AMA Queensland's very successful Wellbeing at Work sessions. Now this follows on from a Beyond Blue survey in 2013, showing that doctors and medical students suffer substantially higher rates of psychological distress and unfortunately suicidal ideation as well, compared to the general population. Now, as we'll discuss today, this phenomenon is certainly multifactorial, but it's not hard to imagine it's been unduly contributed to by the pandemic and the unique pressures we're currently in the midst of. So today's chat with you is certainly rather timely. Now, recognising this, the AMA worked in conjunction with today's guest to develop a statewide initiative that was a first initiative, being the Wellbeing at Work program. These sessions aim to provide interns with the strength and coping skills they need to not only survive, but also thrive in their careers in medicine. Now, Ira and I will be chatting for half an hour, but please do feel free to pop your questions in the chat box and we'll do our best to answer them in turn at the end. And I must say, I've had the pleasure of knowing and working with today's guest for quite a while now. And I know Ira to be such a strong advocate for us junior doctors, and she just really does bring so much positivity and unique insight into all the issues we face. So it really does give me immense pleasure to say good afternoon, Ira, and thank you for taking the time out of your Olympic watching schedule to join us. Can we begin just by having you tell us a bit about your background and also your unique expertise in this space and sort of what got you started and interested in doctors' wellbeing?
Yes, Chris, thank you. Let me first start with addressing the elephant in the room, my accent and my name that you were so incredibly well at pronouncing. I'm from the Netherlands. That's where I did my medical training at the University of Amsterdam. And I actually originally wanted to be an immunologist, but then during my internships, I discovered psychiatry and how it actually encompassed everything I find important in a doctor. So I trained as a psychiatrist, psychotherapist, and systems therapist in Amsterdam. And I've actually always been interested in the neurobiological background, but I worked in a wide variety of settings. And in 2008, I came to Australia thinking it was going to be a sabbatical of 1 year. But, well, we decided to stay longer, and I wanted to use my personal and professional experience to work in prevention and early intervention of mental health problems. So I started a life coaching company called Breeze Life Coaching. And when the AMAQ approached me to work with the Council of Doctors in Training to develop this program in response to the Beyond Blue report, I knew immediately that this really suited me because I could really combine all my personal and professional experiences for it. And it's really good to be doing something where you don't feel an imposter syndrome at all. I can tell you that. And I think we really have to applaud the AMAQ that they decided to go with a peer with lived experiences, because I keep on hearing back from all the doctors I work with that it's so important for the authenticity of the program. Because not only I have clinical experiences, but I also know all about overcoming the struggles of training as a doctor while living with a chronic condition. I'm actually a symptomatic carrier of the hemophilia gene, which makes me have a severe bleeding disorder. And when I was recently interviewed by David Rowland for his book, The Power of Suffering on Post-Traumatic Growth, it really made me realize how much the hemophilia had actually taught me and how it helped me to develop a very positive mindset. So now I work as a life coach, specialized in doctors' health. I'm on the management team of Doctors' Health in Queensland. And I'm currently the president of the Queensland Medical Women's Society, QMWS.
Plugs welcome. And we're certainly so glad you decided to extend your sabbatical, Ira.
Yeah.
Can you tell us a little bit more about what is the Wellbeing at Work program and what do you think the sessions offer for the participants?
Well, it's actually interesting. It started off as the Resilience on the Run program in 2015, but we decided to change the name when resilience, the word resilience, started to be have quite a negative connotation. it felt to a lot of junior doctors as if they were victims being blamed, not working hard enough in unhealthy circumstances. And that, of course, was definitely not the scope of the program. So we changed it to Wellbeing at Work, and now it covers much more the content. And before we, in the initial process of developing the program, the Council of Doctors in Training did a systematic review to see, what components should be in a program like this. And Dr. Margaret Kay has been really instrumental in helping us identify these key components. And it actually immediately showed how we needed to incorporate mindfulness in it, as it was found to be so incredibly helpful for doctors. Now, like so many other doctors, I've been quite skeptical about mindfulness for a long time, thinking it was a bit airy-fairy, maybe alternative. And then I came across the beautiful research that's out there about neurobiological background of the effectiveness. And it actually changed my perspective. And I started writing training programs about it. And I actually discovered the practical benefits of mindfulness when I was working with chronic pain patients as a consultant psychiatrist. Back then, this was the early 2000s. I was actually considered a chronic pain patient myself because of the hemophilia. I had severe osteoarthrosis and osteoarthritis in my joints, particularly my knees. And I've had double knee replacement at a relative young age, which you will know as an orthopedic surgeon registrar, that you don't get that for nothing, especially not at a relative young age. So objectively seen, my symptoms were quite severe, and often more severe than those of my patients, who were actually suffering from their complaints so much that they developed psychiatric comorbidity. And I was really intrigued. I mean, what was it, what the hemophilia had taught me? All these beneficial lessons, and helped me actually to develop this positive mindset. And then I did a mindfulness program, and it clicked. And I thought, yes, much of my coping style is actually can be understood as informal mindfulness practices, because mindfulness actually empowers you to choose what to focus on, to choose your actions and how much you let things impact you without being overwhelmed by emotions. And now, for the first time, I finally had practical exercises to teach my patients to gain more control over what to focus on. And of course, it's not just for patients, it's for doctors as well. But it's one of the reasons why mindfulness is so powerful. But of course, it's not the only thing we discuss in the program. We also have other evidence-based techniques, such as input from ACT, acceptance and commitment therapy, CBT, cognitive behavioral therapy, positive psychology, compassion focused therapy, and input from the research into trauma and stress research, such as the polyvagal theory. So I actually call the program the Slip, Slap, Slop of Healthcare. I don't know if you know that campaign from a while ago, how it actually helps to protect yourself against the harsh radiation of the sun. So you are healthy enough to do something about that hole in the ozone layer. And this program is more or less like that. It actually helps you to stay healthy and energized enough to do something about the negative and the unhealthy parts of the healthcare system. So I bring resources of help that's specifically designed to support doctors. And we also know that some things you can't do with just yourself. You need others, you need to be in a group. And that is why advocacy groups such as the AMAQ or ASMOV or Doctors Health in Queensland are so important, because there's strength in numbers. So the Wellbeing at Work program is actually a very interactive program, and it's full of tips and tricks focused on practical problems, and it has direct input from the interns themselves, because we know that in theory, we doctors, we actually know quite well what we are supposed to do to take better care of ourselves. But the interesting thing is to focus on the practical obstacles, what actually keep us from putting that into practice. So we identify stressors, also personal ones, at work, and healthier strategies to deal with them, how to identify burnout, compassion fatigue, identifying barriers for asking for help and self-care. And we know that interpersonal conflict and bullying in the workplace leads to stress and has a definite negative impact on your communication and patient healthcare. So we discuss difficult scenarios and basic conflict transformation skills. And it's really sad that sometimes doctors feel so powerless from systemic issues. And we know it's really hard for doctors to ask for help. Usually we are far better at giving help than asking for it. And it's so sad that, sometimes doctors don't see any other way out than tragically ending their lives. And I've worked with enough suicidal patients to know that they did not necessarily want to die. They felt trapped. They felt helpless in a situation, hopeless, like there was no other way out than to take their lives. And I just don't ever want any of the doctors to feel that way, because help is out there. But the most difficult thing might actually be to reach out and ask for it and to accept it. And now, I've never been suicidal, but I do know what it's like to thinking that you need to do everything by yourself, keep it all on your own shoulders, deal with it yourself, and actually, creating more pressure on yourself. So I also discuss some personal experiences of mine as an illustration and help understand the interns that there are other ways of dealing with it as well.
That's interesting. So it sounds like the program sort of was born out as an amalgam of all your lived personal and professional experiences. And so that's what I found as a past participant of the program. How do you find that junior doctors receive it? What in particular do you think resonates with the junior doctors that you're speaking to about this issue?
Well, I might actually better ask you that question as a past participant, because I think it's good to hear from participants as well. What do you think?
Well, I think exactly like you said before, I think the interactivity of it was great. And I really particularly appreciate the small breakout groups because, as you said, we don't tend to make the best patients. We don't necessarily know how to talk about personalizing an approach to, in particular, implementing practical things you can do in your own professional and personal lives to protect yourself and inoculate yourself a bit better against these stresses. So I thought that was a really beneficial aspect of the program. And having participated with my colleagues and also my twin, we also found very similar experiences as well. So I really appreciate that practical and personalised aspect of it.
Yeah, yeah. That's what I keep on hearing back from the feedback as well. It's like I said, over the years, I've tried to incorporate all the feedback that we get immediately after a session. And we really notice how it has improved the program. I mean, by now we hardly get any negative feedback. And I must say, I'm very positively impressed with how positively the program is received, and it really shows how much there is a need for a program like that out there, and how important it is to for doctors to just start talking, and knowing that they're not the only ones struggling with these things. So that's definitely what I find from the feedback.
And I must say as well, I think the aspect that's really important and crucial is you're doing it at the start of your career, isn't it? And I suppose that was part of the design. You're learning all these skills before you get into the workplace. So we're quite fortunate as a younger medical cohort to get exposed to these sorts of things. Now, I understand it's been going for 6 years now. Is that correct, Ira, the program?
Yep, that's right.
What are we learning? What are some common themes that you're hearing amongst junior doctors in your travels up and down the state? What does the barometer of mental health amongst junior doctors look like?
Well, so far, I've worked with over 4,000 interns, so it's quite a lot. And like I say, it's really, really helpful to get that direct feedback and implement it. And the one thing that I have learned, far and foremost, is that junior doctors are very resilient. And but I also see how much we are at risk for burnout. And if you look at the 7 core needs that Christina Maslow has actually identified that we all need in our work, you see the mismatch there is for junior doctors and how that puts us at risk of burnout. And then the work of Professor Gordon Parker that shows us that there is a personal, our personality traits that put us at risk for burnout, where we are dutiful and perfectionistic. As he puts it so eloquently, you don't treat perfectionists, you treat them. Well, and it's true. I mean, it makes for very dedicated doctors, but we are very much at risk for burnout. And I think junior doctors more than others. And these personality traits that make us work harder, they also make us at risk of low levels of compassion, self-compassion. And this self-compassion, I think that is the basis for a lot of other problems that doctors go through. I personally think it's one of the main problems that we have as a group because of our personality traits. I've also learned that basic appreciation, it's so important for every human being, but feeling that your organization doesn't value you, it just adds so much to your distress. The other important thing I learned is how important it is to have a safe environment, creating a safe environment to talk about these topics. The power of peer support, like we said before, knowing that you're not the only one, having a sense of belonging, importance of gratitude, and how self-compassion can help you when you're actually dealing with compassion fatigue. The power of authenticity. So you have to practice what you preach if you really want people to listen to you or learn from you. I learned that systems don't change systems, people change systems. And change really comes from bottom up and top down. And leadership is the key to a positive change. So junior doctors are still fairly fresh to the system, and they really need senior doctors to enable change. And I definitely invite seniors to come and sit in with the sessions and to actively participate, because it's extremely important to have these, positive role models. I've also learned that when you talk about well-being during lunchtime, make sure that there's food available. And it's just, I would do these sessions in certain hospitals in Queensland, and there would be these interns, rushing in from the ward, trying to be there on time. And then, of course, they would forsake their lunch and they would sit there hungry, thirsty. I mean, how can we seriously talk about well-being when you have all these hungry and thirsty people in the room? So I'm really happy that the AMAQ has decided to sponsor some basic lunch for the session. It's really, really important. And I've noticed how in certain hospitals, it's really hard to have protected teaching time. So that also means no phones and no pagers. And it's incredibly hard to be placed away from your support network. We all know that isolation can be really hard for mental health, and especially placements in more rural areas can be hard to find a GP. And then maybe if you find one, you might know them from work. So there might, be issues about privacy or feeling out confidentiality. And I've learned that even while facts about mandatory reporting laws are explained, the perception is still causing doctors feel unsafe to ask for help. And that really, really troubles me. I think this perception of unsafety is something that will not magically go away by just, addressing the facts about what mandatory reporting is. I think we need more role models, more senior doctors that talk about their personal situations and how, especially mental health problems that are still so so difficult to address, that that they know that interns can see how it hasn't impacted their registration and their work. So people like Dr. Chris Erian, Dr. Jeffrey Toogood, Dr. Mark Cross, he's a psychiatrist who speaks very openly and writes about his anxiety disorder and bipolar disorder, and he still even works as a psychiatrist. And I think those examples are really important to hear and get that message out.
Couldn't agree more with, in particular, the food point. There's very seldom a message that can't be better delivered with a sandwich in hand. I've always found, certainly. Um,
Yeah.
now, I suppose as Southeast Queensland remains in the midst of this lockdown era, and unfortunately, it probably looks like it's going to be extended by all likelihood. Your experience is really interesting because you're travelling not just here but all over the state, as you've said. How do you feel the COVID pandemic in particular is affecting the mental health of junior doctors across Queensland?
Yeah, well, I think the interesting thing is that, while physician health and well-being has always been an important issue, it really, this COVID pandemic has really put it to the forefront, and it's no longer a soft topic. And I think slowly, doctors are allowing it to be becoming a more important topic for themselves as well. So that's definitely a positive. And I've also noticed at the start of pandemic last year, there was much appreciation for healthcare workers, and it definitely made the workload more bearable. But there was also a big loss of connectedness. Interns who sometimes knew their colleagues only through PPE or online, and there was a lot of anxiety about training, exams being postponed or cancelled, and even less ability to plan your lives at such an important stage of your life. That was very, very tough, and it had a huge impact on direct family members, relationships. Lots of doctors, being afraid for their own health, but also infecting loved ones. And now we see this increased pressure on the system, where there's a shortage of healthcare workers, nurses, there's ramping, high level of code yellow, there's constantly changing regulations, level of vaccination is low, lockdowns, like now, not being able to travel. And this all has an ongoing toll on our mental health. And this all increases the risk of compassion fatigue and burnout. I do think there is also some positive, because I think it makes certain areas a bit more accessible, like online teaching, having these webinars like this. And there's even word that maybe part-time working or job sharing can become more accessible, more acceptable, which I think is very important. I think there's a lot more part-time working in where I come from in Holland than there is here. And I really hope that telehealth will remain available, because this could very well help, those doctors that find it hard to keep in touch with their trusted GP when they are being moved around. And telehealth could definitely help with that.
Certainly a lot of things that we hope might be positives to come out of the pandemic. And I suppose in a similar vein, you touched on it before, we're already seeing a few questions trickling in relation to it, Ira, but we unfortunately know from the data that, at least historically, many health professionals have been reluctant to seek help for fear of professional and personal reprisals. How do you think the perceptions of the current mandatory reporting laws affect junior doctors?
Yeah, like I said, I'm really worried about it. I think especially that part where treating practitioners are required to report to APRA if they deem that their doctor patient is placing the public at substantial risk of harm. I mean, I think we all understand why it was put in place, this law, in the first place. However, these negative side effects, I don't think they had been expected at the start. And I really see how it scares, many doctors, and there might be, all this teaching coming out saying, no, it's only about substantial risk, but you only need one horror story to, break through all the careful teaching that you do, and the horror remains, the anxiety remains, and I think we really need to work on the emotional impact of it as well. I mean, same thing with mental health problems, exemptions for insurance or income protection. And who knows for the future? Maybe this even becomes a thing for COVID. I think those things won't go away with just saying, "Oh, just don't worry." It just doesn't help, and that's why I say, these really lived stories about people that where it didn't impact the registration, but also those horror stories, talk about them openly and look at whether, doctors might have not been or had been reported when it hadn't been necessary. I think that's really important to get that word out there.
And that's certainly the messaging, that the AMAQ was certainly pushing hard to try and challenge. As you said, it can be very disruptive and destructive to think in that way. I guess at the moment, I can already preempt your answer to this question because I anticipate we probably think pretty similarly. But the Queensland government's funded the Wellbeing at Work program and model just for delivery to medical interns or to overseas viewers, first-year graduates since 2017. Now, surely doctors of all ages would be able to benefit from that. Where are we at in terms of procuring further funding and support for it to be rolled out to other cohorts?
Yeah, it's really interesting. From the moment I started presenting this program to junior doctors, I had seniors come up to me and say, why do only juniors get this program? We need this. We need this more than they do. They have a medical education unit. We need this as well. And I think we agree. And I also see this in the feedback forms. Many juniors comment on how they wish that seniors would have a program like this as well, and they know they could benefit from it. So the AMAQ has put forward that the program should be extended actually to doctors in the postgraduate years, P2 to 5, and also doctors working in the private sector. I think, we know how when you work more isolated, it puts you more at risk for mental health problems, and it's really important to get that connectivity and that information out there. So I think it's really important that this program or a program like this is presented to more doctors. I think the need for a program like this is clearly out there, and it's supported by the doctors themselves. I mean, we've been talking before we started as well, about PHOs who are, not belonging anywhere. They're not under the umbrella of the medical education unit. They're not in a college yet. They are at significant risk for mental health problems and compassion fatigue, burnout, and we need to have something out there for them as well.
Couldn't agree more. Could not agree more. There's many more sort of vulnerable populations within medicine. This program would just do so well to serve. I'm mindful of the time. It's now time to move on to some questions. Thank you for sending them in via the email in the chat box. The first one's relating to mandatory reporting laws. Now, I think we already discussed that a little bit before. Still like to thank you for the question. The next one is, does the culture of the medical profession make it hard for junior doctors to reach out if they do need help or are struggling? Sorry, I don't know the attributions of these questions, but it's an interesting question all the same. What do you think, Ira? So do you think we have a cultural problem insofar as how the profession selects for certain personality types and whether people are more reluctant to reach out for help by virtue of that?
Yeah. Well, like I said, I think a lot of this comes back to self-compassion. I think we doctors, we self-select to have personality types that make us at risk of having low levels of self-compassion. And then self-compassion is not the same as self-pity. It really is all about, being able to look at your own actions without being overwhelmed by all this negative self-talk. And this just gears us up to not put ourselves there to actually reach out for help because we think we're not important enough, or we should be dealing with our work first. Whereas you have to put yourself first as well. It's not just you or just the work, but there needs to be a balance. That is why I'm so incredibly stressing the importance of looking more at self-compassion. I mean, the research that's coming out there also into the neurobiology of self-compassion is amazing. And I only wish it had come out 30 years before, because if I look at my patients, in hindsight, most of them were suffering from low levels of self-compassion. And I wish I had better tools to help them then. And I think we have them now. And I think we need to get that word, the word out there as well. And we know if you have low levels of self-compassion, you're very much at risk for compassion fatigue as well. And when you have compassion fatigue, you're not compassionate for your patients and you're not compassionate for your colleagues.
Mm.
And this has a huge impact on the system, definitely. Yes. And then you might be, a junior doctor full of energy, wanting to make a difference, and you come into this group of compassion fatigue people, and it just sucks away all the energy that you have, all the life, all the passion that you have. And it's really important to go back to that initial passion. What is it? What brought you into medicine, and keep that fire alive? And I can't stress enough how important it is, to reach out and do talk. And if you feel like you want to talk to a peer, there is things like Doctors Helpline of Doctors Health in Queensland. I mean, they are amazing. They've been there since 1985. I'm in awe of them. They have this 24/7 helpline where it's free of charge, and you can just call them. Medical students as well. And I think they're doing an awesome job. And I'm really proud to be part of that management team. Definitely, yes.
They certainly do provide a wonderful service, and the tireless work of, in particular, Dr. Margaret Kay and Dr. Anne Elko are famed in the Queensland medical fraternity just for exactly that.
Yeah.
Plenty more time for some more questions if you want to drop them in the text box or the email. I suppose just whilst we're waiting on some further input, be interested to know, in particular, amongst your travels era, are you noticing any significant differences in the themes amongst doctors from the rural versus the more metropolitan sites? You talk about that connectedness and the need for a network. Are we seeing that there's ample supports around a lot of our, in particular, for example, IMG or international medical graduates who are
That immediately came to mind when you said that. Yes,
yeah,
yes. We know it's particularly hard for IMGs. And I know some. So we kept the sessions at 30, because if the group becomes bigger, then it's hard to do the interactive work. But certain hospitals, they ask if some of their IMGs are allowed to sit in as well. And it's just, it's amazing the stresses that they go through, and they don't feel connected to anybody. They don't have, their umbrella um, group, and they need it. They need it more than anyone, because we humans, we thrive through connections. We need others. The quality of our lives, it depends on the quality of our relationships. We need to feel that we belong. And especially when you're IMG, it's so hard it's already fighting your way into the system, and then keeping yourself here and finding your group, finding your peers, your tribe. Yeah, that can be particularly hard. And I do find that I worry for them, definitely. And I know the rural doctors are really trying to make a change in that regard, but it's hard for them. And what I've noticed in my travels, like you said, traveling around the state, of course, I'm particularly lucky that I actually see all the different teaching hospitals and the different atmosphere that they have, and it really makes me realize how, like I said before, systems don't change systems, people change systems. And you only need one DCT, or one person in the right place with enough influence that can actually make a positive change. And you might be in a remote area, but if you have somebody who's really there, who really can make that connectedness and connection with the with the juniors in the workplace, it makes it one of the most popular places to work.
Could not agree more. I think, it's such an interesting point, because oftentimes we're hearing stories of people feeling as though they're sort of jettisoned era. You might be popped in a far reach of Queensland with not a whole lot of supports to your name. So I think formalising those structures is really important, and certainly something the AMAQ's working to try and integrate in tandem with people such as yourself. I guess whilst we're waiting for any final questions, I'd definitely like to ask you, what would you give advice-wise to a younger version of yourself, the fresh-faced Dr. Steenstraten on the ward, brandishing a stethoscope and that Dutch smile? Before you go out into the wards, what would you tell yourself to prepare yourself for a successful career in medicine?
Oh, I
Bit
think I would.
Friday, isn't it?
Yes, I definitely think I had to work on my self-compassion. I mean, like Brene Brown says so beautifully, you know, it's about accepting your vulnerabilities and taking hold of that narrative yourself. That really empowers you. And I think a lot of junior doctors feel so disempowered, powerless. That's one of the reasons why I love the Council of Doctors in Training, you know, where you actually come together, you have a voice. You might feel like you are at the bottom of a hierarchy, but you do have a voice because there's strength in numbers, and there's a group that actually knows what you're going through and is advocating for you while you are way too busy doing your work. And I had wished myself more self-compassion earlier on in the days, definitely. And I wish that for a lot of juniors and seniors, for that matter.
We all know stories.
Yes.
One final question just popped up on the chat box from an anonymous person. With so many doctors in lockdown, how might this impact the mental health of doctors in quarantine and those still at work?
Yes. Well, just this morning, Kim Jennings was her name, isn't it? I heard her on the ABC emergency physician in lockdown. Yeah, the first thing that doctors do is feel guilty. There's so much guilt, feeling guilty that you're supposed to be at home with your family, with your kids, and you feel guilty because you're not there for your patients. But you also feel, guilty to your colleagues because they have to take over, they have to work harder, and I think that guilt, that's something that we did a lot of well-being online work for QDHP last year together with Vicky Dawes. I did those, and one of the main things that came out of there was that guilt, how we doctors feel guilty about so many things. And that is what I worry about most about mental health. And I hope they reach out, and I hope they enjoy the time that they have with their family, because let's face it, usually you're so busy working, and now you're struggling to do some homeschooling. But at least make sure that when you do it, just try to enjoy it. Try to see that there's some fun in it too. And you might not be perfect at teaching, and you might not be the best teacher there is, but at least you're there with your kid, and you can connect. And so make sure you enjoy it too.
And when you're sick of connecting with your family, you can watch the Olympics.
Or you can take a pet and cuddle a pet.
Oh, I believe you've got one off screen as well. Would you like to introduce the audience?
I've got a final practical mindfulness exercise for those that stay until the end. It's an informal practice.
Okay, we wait with bated breath. Before we end today's session, you spoke before about the need to collect information so we can set up strategies and ways of helping these junior doctors. I think it's a really great opportunity to plug the annual resident health check that we do with all hospitals, which is open for the next few months. So this is the 6th iteration of the hospital health check. And it really does give us some rich data to help evaluate the state of junior medical officer employment in Queensland. And it allows us to compare hospitals across the state. So we really do need all junior doctors, where you can, just to spare a few minutes just to participate in the survey, so we get a good understanding of the pressures that we're all facing, anything from credentialing to rostering, remuneration, all that sort of stuff. Because if we don't know about a problem, we can't change it.
Use your voice.
And in a similar vein, we are looking forward to the Townsville Junior Doctor Conference later this month, going ahead on the 28th and 29th. This conference is going to be a great opportunity for junior doctors to connect with colleagues and peers and learn about key issues facing the profession. Moreover, just to be inspired about selecting their chosen medical career path. At the moment, it's going to go ahead in line with the current state government directives. Maybe there might be contingencies for remote interactiveness, but we're still hoping it'll go ahead. It will go ahead in person, certainly at this stage. So please do book your ticket, and we look forward to seeing you there. Ira, thank you so much for speaking with us. I think you have one other message as well before we wrapped up. I just want to say I do forgive you for bringing up the hockey as well. So no hard feelings. There was another event I believe you wanted to mention as well, Ira.
Yes, as president of the QMWS, I want to use this platform to plug a couple of our events. We have a next dinner meeting on the 19th of August, which might be moved to Zoom. But we have Professor Crystal Middledorp. She's a professor of child and youth psychiatry, and she's the co-chair of the Strategy Expert Group, who will update us on the brand new National Children's Mental Health and Wellbeing Strategy. So that's really important, of course, especially now in times of COVID. We have the lovely Dr. Emily Horn, who's actually going to update us on the impact of COVID on children and youth. So especially if that's going to be ahead on Zoom, head to our website or Facebook, join or buy a ticket. But there's going to be a Zoom option anyway. But that's going to, I think, is going to be a really, really important topic. We are going to have 2 self-compassion masterclasses by self-compassion expert Dr. Marga Gorn that I'm very, very excited about. I want to mention the beautiful bush medicine leaf scarf project that is actually a project by the Australian Federation of Medical Women, started by Dr. Lydia Pitcher together with Pia Du Pradel. They make these silk scarves, and you can make donations to the Aboriginal and Torres Strait Islander bursary. Really important, so I really urge you to do that. And last but not least, the AMAQ Women in Medicine Breakfast will be held again 7th of October. I hope we can all go there. QMWS is definitely going to try and get a table or maybe even 2. Title is Reality Bites, Everyday Leadership, Advocacy and Impact, with the wonderful Dr. Melissa Naidoo, and she will be joined by panelists Dr. Ria Liang and Dr. Alex Markle.
That would be fantastic. And
yes,
it'd be remiss of me to not mention if today's chat uncovered any themes for anyone that people might find troubling. There's obviously always hope and help available through Doctors Health Queensland, also Lifeline, Black Dog, and other relevant supports. There is help out there. And we're dying to see Mystery Pet off screen, so put us out of our misery.
Yes.
All right.
Okay, here we go. So I promised you a practical exercise, because if I've learned one thing, is that doctors like practical examples, practical exercises. So here is my informal mindfulness exercise. Meet Penny. Penny is a very fluffy guinea pig. Now, mindfulness and informal practices is all about zooming in the experiences of your senses. Now, you can't, she's already licking me, so I can feel this touch. So this is online, so you will have to engage your mirror neurons, but it's all about imagining how soft okay, she's very fluffy. She smells beautiful of a really nice hay. It's a bit honey-like hay. The only thing that I'm not going to do is taste her. And just remember, even in lockdown, please go to maybe, a pet rescue. Help a pet. We doctors, we like helping. You don't need to go to a breeder. Just get, if you get a guinea pig, just make sure you take 2. You get 2 because they need they need to be together. And but even if it's a dog, you can walk with a dog. But a pet is a very mindful stress reduction therapy.
Everyone, thank you so much for joining. We really do hope to do this again, hopefully in person sometime shortly. Stay safe, mask up, and make sure we stay connected. All the best, everyone. Ira, thank you so much.
Thank you so much, Chris. And thank you so much, AMAQ, and all the people that attended and for the questions.